Hi, I'm Kara. I'm a nurse with Parkview Home Health and Hospice. I'm a clinical supervisor and clinical educator. Today we're going to talk about how to take vital signs. So the first vital sign that we're going to talk about today is weight. Weight is something that is really important for patients to take at home or people to take at home whenever they have problems with swelling or edema, or maybe they're on medications that pull water off of them so they can kind of measure if they're gaining and if that medication is working. A lot of times it's your congestive heart failure patients that we're monitoring those weights daily. You're going to want to weigh yourself first thing in the morning, after you go to the bathroom, wearing about the same amount of clothing or wearing nothing, and then you want to record that weight somewhere where you can keep track. So the next vital sign we're going to talk about is respirations, and respirations are the number of times that you breathe in and out with your lungs. Normal respirations for a person is 12 to 16 breaths per minute. If your respirations are out of those range, you would want to talk to your physician if you're having any shortness of breath or any other conditions that might affect those respirations. So one of the next vital signs that we can talk about is temperature. Temperature varies from person to person. It also varies depending on the environment that you are in at the time. So there's not really a normal temperature for every person. One of the ways that you can check your temperature at home is you can get the ear thermometer, and you can use this ear thermometer to insert into your ear and take a temperature that way. It's pretty quick and easy. The other way you can check your temperature is you can get an oral thermometer. This oral thermometer can be used orally under your tongue, or you can do it under your arm. It must be in contact though with your skin, and so you want to hold that firmly under your arm. The next vital sign that we're going to talk about is your heart rate. It's also called a pulse, and that's the number of beats your heart beats in a minute. So one way that you can check that is you can take your first two fingers, you can hold it against your carotid artery on your neck, and you can count the number of beats per minute. Watching a second hand on your watch or on a clock is the best way to do that. You can count for 30 seconds and multiply that times 2, or you can count for a full minute. The other way you can do it is you can go to your wrist and you can place 2 fingers on the thumb side of the wrist. Again, putting a little bit of pressure, and you can monitor for 30 seconds and count and multiply by 2, or you can also go for a full minute. The normal is 60 to 100. So some athletes might be in the 40s or 50s for their heart rate because they're extremely fit. If you're consistently above or below those numbers, you might want to seek advice from a physician to make sure there's not some underlying issues. You want to make sure you're writing these down and keeping track because your heart rate can vary from time to time. So this is the device that you would use to measure your pulse oximetry. There is a light in there that helps to read that pulse oximetry. You need to make sure that you don't have any fingernail polish on when you get ready to use this. Also that you have no swelling in your fingers or hand that you're using the device on, and then making sure that your finger is dry. So you're gonna put this device, you're gonna squeeze it, and you're gonna put one of your fingers in there and you can turn it on. It's then going to give you a reading. It's gonna give me my heart rate, and it's gonna give me my oxygen saturation. So oxygen saturations for most healthy people should be at 95% or above. If it is lower than that, then you may want to speak with your doctor. So we're going to talk about blood pressure next. That's another vital sign that patients might take at home. The reason you might take your blood pressure at home is if you're on medications that control your blood pressure or can lower your blood pressure, or you have a heart disease or heart condition that might need to monitor that. Normal blood pressure is 120/80. That being said, if it's over that or less than that does not necessarily mean it's a concern. You need to establish your baseline blood pressure. The best way to do that is to start taking it and recording it and seeing what trends you might have. And then if your blood pressure tends to be higher or lower than those trends, then you would want to notify your physician. Most people use an automatic blood pressure cuff that you can buy at most any stores or drugstores, pharmacies. Those are the easiest for people to do on themselves. So I have an automatic blood pressure cuff that I'm going to use here. I'm going to go ahead and open this up, and you can just slide this up your arm. You want to try to get it on skin and not on clothing. So you're going to pull that over and get it tight. Back here I have my blood pressure monitor, so I can go ahead and push the start stop button. And then it's gonna give you a blood pressure reading, and it's going to give you your heart rate so that way you can record those in a notebook. So that's how you take your vital signs at home. Again, remember, if any of your vital signs are abnormal for you or you are having any distress, you need to make sure that you're contacting your medical provider or you're seeking medical attention.